I was on call this last weekend, Labor Day weekend, and we had several patients actually that came in with spine fractures. So first, drinking and being on an off-road vehicle at the same time don't usually go very well. So that's one consideration. But I wanted to talk a little bit about how we evaluate spine fractures and some things that I think are relevant for you to know about having a spine fracture. The surgical decision-making for spine fractures takes into account three things. Number one is the morphology of the fracture. What's the type of fracture? What does it look like? How much of the bone is involved? Number two, is there involvement of the associated ligaments? And number three, is there involvement of the spinal cord or nerve roots? And depending on how much of these three components is involved with the fracture dictates, in part, whether or not we do surgery for it. One of our jobs when we're on call, or just as a neurosurgeon in general, is to decide and make the decision on recommendation for surgery, and then to perform the surgery and to counsel the patient on the postoperative recovery. I wanted to comment though on this evaluation scale for the fracture itself. The morphology of the fracture, the ligaments, and the nerves or spinal cord. And that's an important principle. When a patient suffers a spine fracture, they've also injured the ligaments that are associated with the bone that broke. And we forget about that. We just think it's the fracture itself and recommend a brace or do a surgery, look for the bone to heal, and then if the bone heals, we're like, great, it's healed, and you move on. Ligaments, though, heal with a different time frame and under different circumstances than bone heals. Nerves and spinal cord heal differently than ligaments and bone as well. So when we think about spine injuries and spine fractures, I think we need to think about managing the bone, the ligament, and the nerves and spinal cord, if relevant, in specific ways. If a patient has a bone injury, you would want to brace the injury like you would put a cast on for a broken arm. And we do that. We put braces on, we put screws in. The bone sets and then it heals, and then you take the cast off and it gets stronger with time. Ligaments actually heal a little bit differently than that. They respond better when they're under a little bit of stress. And as they get stronger and they're stressed more, they get stronger from the stress. So when a patient's in a brace, for example, after a fracture, it's maybe good for the bone, but it's bad for the ligament. So working with good physical therapists and even chiropractors and others to manage the ligamentous injury when a patient has a spine fracture is really important, because that can lead to a lot of long-term issues that are often overlooked. So I just thought it would be helpful to talk about how when a spine is fractured, consider the ligamentous injury, and that may require some longer-term management even after the bone is healed.